Alright, come along, follow me right now. Gonna test the cranial nerves and show you how. Starting from the top, number 1, olfactory. That's the one that tells you whether or not it's smelly. What do you have that's not unpleasant to sniff? Grab your morning coffee and let them take a whiff. Optic nerve is next. Cranial nerve 2. Helps with the vision, tells you which is better, 1 or 2. Now keep looking at me. How much do you see? Point to the finger that wiggles in the periphery.
Wiggle, wiggle, wiggle.
Checking the vision and the extent of it, making sure there isn't a field deficit. We're gonna cheat a little here, do some Nerdz in conjunction. That's cause they help to do the same function. 3, 4, and 6 do the EOMs and more. To the left, to the right, the ceiling and the floor. 3 does a little extra, that overachiever. Keeps the eyelids up. Thank you, elevator. Also the pupil, swinging flashlight to see whether or not the patient has an APD. But what are the eye muscles it controls, you say? Inferior oblique, superior, inferior, medial, rectus, all the way. Start the H pattern, moving slowly. I'll explain the other nerves momentarily. Nerve number 4 is made uniquely. It decussates and exits dorsally. Contralateral, superior, oblique to innervate. Lesion patient can't keep their head straight. Sin, rad. Don't forget it now. Intorsion, depression, abduction, wow. I'll come back to 5, still doing EOMs. Cranial nerve 6 is where the abducens. It travels to the lateral rectus ipsilaterally. Left, left, right, right, respectively. Back down to 5. Trigeminal, baby. Little bit of motor, but mostly sensory. Got the dermatomes, V's 1, 2, and 3. Tell the patient, close your eyes. I'ma touch you gently. Gonna take this bit here from Dr. Pate to help the patient differentiate. Take a Q-tip and break it into 2 parts. One side soft and one side sharp. Touch the patient on the skin, the forehead, cheeks, and the chin. Patient may think it's a little queer, but if they know the difference, there ain't nothing to fear. Remember how I said there was a little bit of motor? It helps you to chew. Using the masseter. Does it still work? How do you check it then? First clench your teeth, then let your mouth open. And while we are here, we can check on 12 and 10. 12 hypoglossal, now this will give you a tickle. Have them stick their tongue out and give it a little wiggle. Push it up against your cheek, don't let me push it back in, just to make sure that there is strength within. 10 is the vagal, pretty important, the goat. Did you know it moves the uvula at the back of the throat? Just take a look while the patient is saying ah and see if there is a bending of the uvula. Almost there, just a few more to go. 7 is the facial nerve, don't you know? It's the opposite of 5, as you'll soon see. It's mostly motor with a little bit of sensory. Make a face, any face you wish. You can pop out your cheeks and look like a fish. But as an optometrist, how does this affect the eye? Well, my friend, that's the orbicularis oculi. Have them shut their eyes. Keep them closed tightly. If you force it open, Bell's phenomenon you'll see. Speaking of bells, a palsy would be apparent because a side of their face will be non-expressing. The sensory aspect of 7 is not a waste because it helps with the interior 2/3 of taste. If you haven't been listening as I spit this hot fire, you might have a problem with your vestibulocochlear. 2 parts of test with this nerve right here. Rub your fingers to see if they can hear. Don't do it hard, just rub them gently. See if the patient hears them differently. The kind of thing that we will do next is perform what is called the Romberg test. Get him out the chair, have him stand up, have him stand at attention. 10 hut. Tell them close your eyes and assess their stance because nerve 8 also helps with balance. Next is 9. Glossopharyngeal. Simply put, it helps us eat a meal. The start of digestion, swallowing and salivation. Normally on auto, just ask the patient to swallow. 10 we talked about a little before, but believe it or not, it does so much more. It keeps you a-going, a living and a breathing, cardiac, digestive, and respiratory system. This is the easiest test to do if you couldn't tell. Just make sure the patient is alive and well. 11 is the last nerve into which we delve because we already covered nerve number 12. 11 is the accessory. Play a little Don't Let Me and taking this bit from Mr. Shaggy. Ready? Here we go. Shrug your shoulders and when I push down, don't let me. Now to the right and when I pull it, don't let me. Now to the left and when I pull it, don't let me. And just like that, man, we're all through. Ain't nothing grand, ain't that hard to do. So the next time you get a crazy patient and something seems amiss or errant, take a deep breath. You got this, dude, cause you certainly have the aptitude.
Yeah, I think you should read it too. Yeah, I think if you want.
Yeah, because you're not into it at all yet, right?
So
That's okay. Let's just do this one and we can find somewhere else.
Sure, we can do that.